nation or country, Jamaica, is experiencing a challenge where dentistry is concerned. We are ranked as the 15th in the world in the worst case of periodontal diseases.
Because a lot of persons in Jamaica don't have access to health care.
The average age of dental professional in Jamaica, in particular dentists, is about 50 years of age. We have a ratio of about 1 in 17,000 dentists to the population. So most of Jamaica is basically designated as what is called a dental professional shortage area.
My name's Dr. Glasman, and I'm an endodontist. I've been coming to Jamaica since the late 80s, and in the 90s, I started doing some charitable work in different communities in Jamaica where I've been providing dentistry, usually emergency care, for children and adults alike. My first contact with Dr. Mackenzie was in the late 90s, who ran the continuing education department for the Jamaican Dental Association. And I told him I was coming to Jamaica and I'd love to come and speak to your group.
It was quite impressive because out of his training seminars, he basically empowered general dentists to do what is safe in terms of endodontics and to be more proactive in terms of doing those root canal treatments.
During the development of the school, which I had no clue that they were doing, I got a nice email from Dr. Mackenzie congratulating me that I've just been appointed adjunct professor of dentistry for the University of Technology in Kingston, Jamaica.
I bent his arm, twist his arm a little bit, and he has come on board and he has offered what we call in Jamaica 110% of effort, and he has also helped us to secure a lot of needed supplies and equipment. So it's just now since 2010 that we basically established a dental school in Jamaica, and where we are actually training professionals now to world standard.
Dr. Glasman is recognized as one of the authorities in oral endodontics, very knowledgeable, but also very altruistic. You know, and he started here and was basically volunteered to run the program in endodontics, which he took over, spent hundreds of hours creating the curriculum and also bringing equipment and techniques and volunteer donations into the school. So a lot of time, a lot of commitment, and he just loves students and he loves teaching, and it shows.
I mean, I've had several opportunities to go to elementary schools, one's in Black River, Treasure Beach, and most recently downtown Kingston, Jamaica, where we worked in a facility in a church. Over 200 patients came by, and I imagine if we had kept that clinic open 24/7 for the next 6 months, that we would probably have a continuing flow of patients. I mean, it touched me, not only the interaction of the students and the passion that they showed with the locals, but the appreciation that the locals had.
I don't even know how to describe the appreciation that we all feel as a class, as a school, because even currently, there's not a local endodontics teacher here. It's really a great opportunity that we have someone like Dr. Glassman here to teach us. He's one of the best. And it is better to learn from the best because it pushes you to become one of the best as well. It's a big opportunity and we will be forever grateful for it, especially in Jamaica, third world country, with first world persons coming to help us. It's really good.
Gary is like a lifeline. Let me say that, it's like a lifeline. Because of Gary, we have gotten significant benevolence in terms of supplies of equipment, endodontics, reamers, files, paper points, including a microscope, a surgical microscope. And these are really, really significant contribution to a small island like Jamaica. And I think without donation, I don't think we would have been here.
My hope for the school is to provide the best possible education that these students can have to provide the best possible care for the people of Jamaica. And And we're very fortunate to be able to live the lives that we live. And this is my opportunity to give back, to be able to provide my expertise in a way that will help others. And hopefully I can make a difference.
I think Gary means so much to us because what he does from the bottom of his heart, and he does freely. And he comes religiously and he's always on time. The students enjoy him, and I'm happy that he's on board with us.